Hello, my name is Logan, and I'm here today to discuss my health communication plan for preventing and reducing the prevalence of HIV in Alachua County. This plan is focused around Healthy People's 2030's objective to reduce the number of HIV infections, specifically in adolescents. What is HIV? Now, STDs have been on the rise for years. Some diseases lay dormant, such as HIV, which makes it even more dangerous. It can spread without you even knowing that you have it, and HIV can be spread in three ways: sex with two or more people, from mother to child in childbirth or through pregnancy, and through shared needles and blood transfusions. The virus spreads when blood, semen, and vaginal fluids enter the body. Eventually, it turns into AIDS, which is the lethal form of HIV, and it occurs in about 10 to 15 years once the immune system has been severely damaged. There are many risk factors: unprotected sex, sex with multiple partners, history of STDs, forced engagement in sexual activity, misuse of alcohol or recreational drugs, injecting drugs, just being young. But however, transmission of HIV can be prevented. Now, using contraceptives such as condoms is one way to prevent them, getting vaccinated. But the most effective way is abstinence, which is not having sex. Other various methods of preventing HIV include staying with one partner that is uninfected, getting tested before having intercourse, limiting alcohol and drug use, open communication with your partner, the male getting circumcised, and pre-exposure prophylaxis or PrEP drugs. And you can treat the symptoms and prevent transmission, but there is no current full cure. The medical community is working on a cure, and currently and recently there actually have been a few subjects that were cured, but there is no full-blown cure as of right now. Now, who is most affected by HIV? Most at risk is African American and Latin minority groups, as well as gay and bisexual men, and the age group that we're looking at today, which is ages 15 to 24. The contributing factor to this is that gay and bisexuals and adolescents tend to have multiple partners. So they also have this mindset of invincibility, feeling like they won't get the disease, even if they believe it to be true. And this kind of touches on perceived susceptibility. So the CDC gave statistics about the risk of herpes among different racial and ethnic backgrounds, and African American people were of the highest risk, next to non-Hispanic whites and Mexican Americans. Now, the solution: in order to solve this problem, we need to focus on three major things: knowledge, awareness, and attitude. Knowledge: how do we prevent it? Awareness: how prevalent it is in your area, that's important. And your attitude: we need to decrease the negative stigma around it. Now, the main goal of this program is to reduce the number of new HIV infections in adolescents in Alachua County, particularly by 25%. Now, participants will be able to, by the end of this program, they'll be able to list 3 health risks of not using condoms, take action in getting screened and tested, and changing their influence in the belief that prevention methods such as condoms truly reduce the risk of HIV. Well, how am I going to achieve this outcome? I'll tell you how. A key promise that this program has is if you choose to participate, if you get tested regularly and you use contraceptives when having sex, then you will be able to decrease your likelihood of HIV infection. This promise is based on the CDC's evidence that where they found that regular testing contributes to people knowing their status, which in turn leads to a reduction in HIV prevalence. When you know, you can prevent yourself from transmitting it to other people. Now, these messages are in hopes to get people to start getting regularly tested and using contraceptives in sexual activity. Now, on this next slide, we're going to look at the prototype, which is on the right. And it says, know your HIV status today. So this is a poster that's going to be displayed in waiting rooms at clinics, in the lobby of religious centers, in local community centers, and hospital waiting rooms. We're also going to put this on some social media channels like Instagram and Facebook, and we're going to have interactive posts. as well as the scannable link to sign up to participate in this program, which is what you see in the middle right there, that QR code that's black and white. And the message of the prototype is clear and concise. Get tested and know your HIV status. The main focus of this poster is to influence people to increase their knowledge about this issue. Okay, so how we're going to roll out this program, we're going to kickstart it off on December 1st. That's going to be our launch date. And this is actually validated by the US Department of Veteran Affairs that the month of December is HIV and AIDS Awareness Month. This is also around the time of holidays like Christmas and New Year's, when people become more sexually active. And our Kickstart launch on December 1st is going to take place at a few high schools in Alachua County and at University of Florida and at Santa Fe College. Now, the Know Your HIV Status Today program is going to run through the entire month of December. On the first day, Magic Johnson is going to visit each school throughout the day, and he is a professional basketball player that currently lives with HIV. So, I think he'll be able to speak and engage a younger audience's attention, and as a celebrity, be able to kind of influence them a little bit positively in this subject. And so this day is also going to be broadcasted on the news and the local news of Alachua County. And it's going to include the image of the poster that you saw on the slide before. And we're going to be posting on Instagram and Facebook a few times a day. And the posts are going to emphasize the message: if you don't get tested, you won't know. So there'll also be opportunities for raffles for free condoms, stickers, pins, and t-shirts, as incentives kind of influence younger generation pretty well as well also. So the evaluation plan, after we go in and, have the participants fill out the survey that's including the Likert scale, which is shown on the right-hand side, we're going to do some follow-up text messages, and we're going to question the participants about their thoughts on the posts following their participation. And we're going to measure the number of participants that completed the survey, which includes that Likert scale and those questions. And like I said before, Likert scale is shown right there. And we're also going to measure social media interactions, like likes, views, comments, and shares, which will be able to tell us, how many people are engaging and if our social media, is actually getting through to our participants. And we'll be able to see this through the answers on the survey. We'll be able to evaluate our success of the program through percentage of participants able to list the 3 risks of not using condoms, the percentage of participants, reporting having been tested and screened since the program, and a number of participants who answered yes to the survey question about using condoms in their recent sexual encounters. So the Likert scale responses from the survey are also going to help us, see if we can determine whether or not that stigma, the attitude surrounding HIV has actually changed a little bit since people have participated in this program. And this is going to allow for both a number, quantitative evaluation, as well as a descriptive or qualitative evaluation of the program. So thank you so much for listening, and I hope to see you participating in Know Your HIV Status this December. Thank you.